And the report established, in my view, and did so indisputably, the linkage between health investments and the socio-economic development of our nation. To this end, the report proposes a new social contract centered on health to address Nigeria's need to define the relationship between the citizens and the state. And the further recommendations that prevention has to be at the heart of health policy, given Nigeria's young population, and requiring a whole-of-government approach and community engagement. The whole notion of one nation, one health policy to attain universal health coverage, which would, we're told, particularly benefit those segments of the population bearing the highest disease burden. An ambitious program of healthcare reform to deliver a centrally determined, locally delivered health system, including providing health insurance for 83 million poor Nigerians who cannot afford to pay health premiums. A health system that encourages innovation and engages communities to ensure that existing nationally driven schemes have local buy-in and are sustainable, and also reforming the policy and regulatory landscape to unleash the market potential of the private sector. Then a whole system assessment of the investment needs in Nigeria's health security, in which the pandemic, and I think the pandemic has exposed those particular weaknesses. We now can tell what those weaknesses are, and in order to redesign and rethink our health security needs, I think there's enough that we know now, and perhaps more than ever before since the pandemic. And also that government should lead the development of standards for the digitization of health records, better data collection, registration, and quality assurance systems. And I believe that this objective of a new social compact is important if we're even to meet the constitutional guarantees that we've sworn to, encapsulated especially in the right to life, to our citizens, and the primary aspiration of the fundamental objectives of the Nigerian state, which is the well-being of the Nigerian citizen. So I think the report captures what it is that must motivate government to be more concerned about health policy, and especially to place health policy at the center of the social compact between the Nigerian citizen and the state. I must say that this government has placed great emphasis on advancing the health of all Nigerians. We put primary health care at the heart of our reform effort, which ensures that basic healthcare services of high quality is delivered to Nigerians irrespective of where they live in the country. And we believe that the health of Nigerians does matter. And we've therefore focused interventions on the people living in the rural areas, women, and of course, vulnerable populations. Of course, there's no way by which we can say that we've done enough or nearly enough. The challenges are there for us all to see. And I think the report underscores those challenges and, of course, puts all of the responsibility where it ought to lie. But we welcome innovation and fresh thinking to further improve Nigeria's health outcomes. And I think this report provides a number of excellent recommendations, some of which are already being implemented, but many of which we will have to carefully consider. The timing of the publication of this report is important, and I think it is particularly apt because Mr. President has just inaugurated the Health Reform Committee, which he's asked me to chair. And the committee, I believe, will benefit immensely from the input of the experts who authored this report, and in fact from the entire report itself. The need to provide our people with universal health coverage led to the enactment of our National Health Act 2014. Based on this important legislation, this government, and I believe future administrations, are well placed to expand coverage and provide the much needed health care. So I want to thank our health minister and, of course, all the health officials for the hard work, and we've heard also the extremely commendable work that the task force on COVID-19 did, which I think displayed our public health system in the best possible light and has shown that we do have a robust public health system, and that, yes, it needs some tweaking here and there, but that we're quite prepared for the challenges of the future. Government, the federal government, will continue to promote the welfare of all in the health sector. And I must say that also that we're extremely grateful to the commissioners who authored this report and to the Lancet, who have provided their global platform to publish this report. It is therefore my very special pleasure and privilege to formally launch the Nigeria Commission report, Investing in Health and the Future of the Nation. Thank you very much.
Thank you ever so much, Your Excellency, the Vice President of the Federal Republic of Nigeria. And thank you so much for coming to launch this very, very important report. I like the One Nation, One Health. I think we can all keep on repeating that, as it is a unifying message about the importance of prioritizing health and the importance of all the things that we know we need to do to improve the health sector. As I mentioned, there is a slight change in the order of the program, as you would have noted. And we've been informed that His Excellency may need to leave shortly. So we would like to take some group photographs. And I'd like to please invite our distinguished guests, the heads of the parastatals, the WHO, the Assistant Director General of the WHO, the representative of Ministry of Health, Dr. Osage Ehenire, Dr. Alex Oko, to please join us on stage, as well as Professor Ibrahim and Dr. Aliyu, and of course the Secretary of the Government of the Federation, Mr. Boss Mustafa, and also would like to invite, of course, your distinguished Senator, Yahya Oloribe, take a group photo before the VP needs to leave us today. Thank you so much. Could we please have the national anthem? Thank you very much. So please, could we have the national anthem? The event now continues once the VP leaves with the panel discussion. Thank you.
Hello.
People to sit down now.
Yes. Hello, could you please be all seated so we can continue and move to the next item on the agenda? We have quite a few things we want to get through. Could we all please be seated? Thank you so much. All the teams, all the people standing in the aisle, if we could please be seated so we can continue with the next item. Okay, that's fine. Yeah. Okay. Could we all please be seated? Thank you so much. We'd like to move on to the panel discussion now. I think we've heard a lot so far of the findings of the Lancet report, but now it's time to digest some of what we've heard. I'd like to please invite the distinguished chairman, Committee on Health, Dr. Ibrahim Olori, to please and introduce our panelists for the next session. So, the distinguished chairman, if we could please have you come up to introduce the panelists. Thank you, sir.
Good evening, distinguished colleagues, ladies and gentlemen. Let me just say I align with all the established protocols, and more particularly because we are going to scientific sessions, so there will be all the political niceties which will be discussed, isn't it? So if I'm excused like that, so I will proceed straight away. I've just been drafted to perform the role of inviting our panelists and the moderator for the panel discussion, which will be very essential for us to have a better understanding of the report as we read it after today's launch. So I have the privilege and honor to introduce a colleague and brother, Dr. Sani Aliyu, who will be moderating this session. I'm sure all Nigerians know sort of Sani Aliyu, doesn't it? Because with COVID-19, if you don't know him in Naka, you know him with COVID-19, isn't it? So Dr. Sani, you are welcome. And I'm pleased that the panelists is gender balance and affirmative action is far more than represented. So the next person I'll be introducing is Professor Iroka Okeke, a professor of pharmaceutical microbiology at the University of Ibadan. So, Prof, you are welcome. So I'm not reading all the details because this is already distributed in the program. And my lost but found friend and colleague, I've not seen him for years. Where is he? Obina. So he's dressing differently today. We work quite a lot since the last 20 years ago in a lot of researches and writing some of the policy documents. So Professor Obina Owujekwe, you are welcome once again. At the fourth, but not the least of the panelists, is Professor Eme Uwaje. She is a public health physician from the University of Ibadan. Prof, you are welcome. I will have the privilege once Professor Uwaje takes her seat to hand over the microphone, or I think maybe the microphone there is working, to the moderator, Professor Sani Aliyu, to lead us in conducting this panel discussion. Thank you very much.
It's working. Yes, it's working. Thank you, distinguished Senator Ibrahim Olorigbe. I'll start first of all, since we're running a bit out of time, if I can just stand or sit on existing protocol, if that's okay. I'll start with Iruka. Iruka, I have two questions for you. The first one has to do with the burden of disease paper, which we've just published. A fascinating paper, really. I would really encourage you to read it. So while we were doing the burden of disease paper, we realized that there were gaps in the data, significant gaps in terms of what is available. And I would like to know what are the opportunities to advance health information systems and disease surveillance in the short and long term? In other words, how do we fill in this gap, which is so essential when it comes to health programming?
Yeah, thank you so much, Sunny, and thank you everybody for coming for this launch. I think one of the things that was really important to us was to make sure that the report was based on evidence. And so it was really important to look at the data and understand the situation of health in Nigeria. And one of the things we found was that data is often looked at as a research substance, something that researchers collect to write their papers and their projects and so on. So data is not always there. Even when it is collected, the data are very, very difficult to access, even by the people who should be using them to determine what they need to do for their work. So data is something that allows you to know whether what you're doing is going properly or not. And one of the things we found was that health workers, actually, even those who are collecting the data, do not have access to the data. So I think it's really important for us to think about how to make data easier to collect, because it is work to collect data, but also easier to use for the people who are actually providing care or preventing disease. And it would really, really help if we use digital methods to collect and share these data. We already have some platforms that will make this possible, but they're inadequately deployed. And so we really need to use them to collect better data. The few data that we did collect, which is in this is the burden of disease paper. So I saw some people moving away and saying, I've got the report. No, you haven't got the report. This is the report. But it's an accompanying paper that actually shows you what we did find. And we were actually, at least many of us, were somewhat surprised to find that even countries that are spending less on health, or that have less to spend on health, are doing better than we are. And so if we keep a careful eye on the data, we'll be in a better position to know how we're doing and where the gaps are.
Thank you. Thank you, Erica. That's really very clear. I think what I'll do is I'll move on to Eme, and then we'll do another round at the end of the first run. So, Eme, our report argues that the adage, prevention is better than cure, remains true. And this is particularly important in a country like Nigeria, where we have such a large young population. What do you think are the two key opportunities to advance the prevention agenda?
Okay, thank you very much. I think the key opportunities are engagement with the various sectors that are involved. And there's some low-hanging fruits. Immunization. We have a really young population. And if we target immunization strategies, they're cheap. And we can save so many lives from using preventable, preventable diseases by addressing this and ensuring that people have access to these vaccines. Our immunization coverage is extremely low. It's actually abysmally low, embarrassing, like less than 30%. And as we've said, other countries that are not as rich as us actually have higher immunization coverage rates. So what can we do to increase this immunization coverage rate? The other thing that we could do is actually addressing nutrition. Nutrition for children is a key indicator of brain development in the first 12, 24 months of life. How can we engage other sectors and ensure that we have access, our children and our families have access to nutritious food? Our country, all over, you travel all over this nation, you see that there's food. Different seasons, there are different types of food. But there's also a high level of wastage. 70%, 80% of the food that we grow in this country is wasted. So how can we begin to engage other sectors and work with them to ensure that our children get access to the food that they need? So nutrition, immunization, two key strategies. Thank you.
Thank you, Eme. So really, in other words, We don't need to spend a huge amount of money, Senator Olorugbe, to implement aspects of this report. All we need really is good food and Faisal giving us the vaccines. We'll now move on to Obina. Obina, as we're aware, you can't say government hasn't been increasing spending over the years. We have increased spending in health, maybe not to the level of the Abuja Declaration. So is it really too little money, or is it inefficient use of money that is hampering our systems? Or is it both, as the commissioners suggest?
All right, thank you. Well, I think I'll use the MDGs and SDG context to answer the question. First of all, during the MDG, the country was awash with money from debt relief grant. We didn't achieve any health-related MDG. Nothing was achieved. So there was money, but nothing was achieved. But still, the country is still not putting enough money. The public funding is still very low. Citizens, 78% out-of-pocket spending tells you that people who are funding the health system are the people. Government money there is just to pay government workers who work in the system, and most times they are absent from work. So the citizens fund the health system. So which means you can actually scrap the government system and nobody will notice, because the funding comes from the people. But I think we need to look at it that even when the system is awash with money, we've seen millions of dollars, either as grant or as loan coming into the health system, and nothing to show for it. So it tells you that inefficiency is a big problem. Corruption is a big problem. People are feeding fat. Nothing is getting to the people. So once you have a system that is inefficient, corrupt, is not accountable, not transparent. So you can pump 1 trillion into this system. The SGF alluded to it. Nothing will happen. The way the system is structured right now. So we have that problem of that no money will make any difference right now, as we say it. But still, a situation where the citizens are the people funding the health system is still not acceptable. The government has to come in more, but it's how does government come in? When the distinguished Dr. Olorugbe was the ES of HEFON, we were doing strategic, well, let me call it budgeting. Then government budget had to have a target. What would the budget for this year achieve? Some say, okay, if no intervention, if you put something in the budget and it's not for MDG, it gets knocked out by budget office. But now the budgeting is no commas. It's all commas. They just do, there's nothing to, no target for budget. So we make useless budgets annually. You won't achieve anything, put any amount you want to put there. But the government still needs to put some money. Like we alluded to in the report, either through insurance, people who cannot pay for health insurance, the poor, how can government route the money to pay for their premium? So I think the way we spend the money has to change. The system really needs an overhaul. The way the system is structured now, it will not achieve anything. So it's actually twin devils. Both system cannot make you adequate money of appropriate money of what is in the system, but still the system needs money. So how do we solve that? Thank you very much.
Thank you, Obina. A very good answer. So really, it's about improving governance when it comes to health system delivery. But Senator Olorugbe, we still need money.
Money is also
we still need money. And I think there's also sometimes from the public side as well, there's a misunderstanding when it comes to budgeting. As a former chief executive of an agency, I know that when I'm told my budget is X, it doesn't necessarily mean X. It just depends on how much is released. So you can make a case for ring fencing the health budget and making sure if the budget is 1.2 trillion, it's 1.2 trillion that will be released because it's always a recurring issue every year. every year. And to me, there's no point in being aspirational when it comes to budgets. We should be able to budget what we can afford. If we cannot afford a budget of 1.2 trillion, there's no point putting it in paper if we know that we can only release a quarter of that. So moving on to, I think I'll come back to Erica. We've got Dayo sitting down there. So Dayo will tell us that viruses evolve and genomes are important, and we've always been told about different variants. We've got Omega. I think we're now starting to run out of the Greek alphabet. Dayo. So, Erica, since we know that viruses evolve, what are the opportunities for sequencing to inform our preparedness given that we have serious resource constraints?
Yeah, it's a question that since the COVID pandemic started, I get asked more often. 3 or 4 years ago when I was talking about, well, we want to set up pathogen sequencing in Ibadan, people were like, what's this esoteric white elephant thing that you want to bring into the country? And now we know that with sequencing, first of all, you can identify pathogens. There was very recently a yellow fever outbreak that would have been missed if it wasn't that they had a complete open way of saying what is the pathogen, even if I have no clue. And sequencing allows you to do that. And then when you have pathogens, COVID is the example, knowing what the variants are informs your response. It also helps you know where the pathogens are coming from. When the pandemic started, we thought that things were going to come directly to us from Wuhan. And when COVID came into the country, it was sequence data that let us know that the route is via Europe, for example. So sequencing is very fine in that it can tell you things about pathogens that you might not obviously see. But I do want to just end by saying that it's not just viruses. Now we're getting sequence data from bacteria that's showing us that we miss many hospital infections in hospitals. You see the same organism in the patient in this bed and this bed. You think they brought it in independently, but sequence will tell you that they actually caught it within the hospital. And as much as sequencing is costly, the cost of not sequencing is even greater. And so these new technologies, just like digitization, are things that we should think about. How can we use them judiciously within our health system? Thanks.
Thank you, Erica. So we'll now move on to the issue of the narrative. Emma, I'm back to you. So the report talks about changing the narrative when it comes to health and looking at public health really from outside the health sector, having a more sort of a multi-sectoral approach. But then health is not the only priority for government. We've got education, we've got security, we've got so many other things. So why must we have health in all sectors?
Thank you. Health definitely is not the main thing, but health is wealth. A healthy person can work effectively. So how do we engage the other sectors, and even for us in health, thinking that, ours is the most important? We talk about poverty, ignorance, and disease. So poverty automatically talks about economy. It talks about getting good jobs. It talks about access, people being trained and being skilled, being capacitated to be able to access the job market. It talks about a provision of jobs. One thing that's very interesting when we travel abroad, you see a lot of young people that have jobs to do. There are industries that can be established in this country that would give access for jobs. Millions of jobs can be developed. For instance, as we came in today, we were picked up by an Innoson bus. I was so excited. Why do we have to import these cars and these buses when we can make them in this country? Look at the whole issue with the PPEs. There are people in Aba and other places that could make them, and that would provide jobs. Once there are jobs, you would have income for the family. That would ultimately eradicate poverty. So, and then ignorance. Ignorance leads back to education. If our people are well educated, if women have access to education, and we have access to education even in the rural areas. Most of us are in our generation, or even our generation and the generations before, there was access to education not too far away. We find that education has become rather elitist in this country. And this is something that, if we're not careful, will come back and bite us in the health sector and in terms of security. It is to our own benefit, and it's to the government's benefit, for us to provide access to education. There was something I was reading recently, that medical education has become elitist. So there are people that came from their villages because they were intelligent enough and they had access to education, they could access medical education. So these are some of the areas. Back to environmental health, environmental engineering, provision of water and sanitation, transportation, rural infrastructure. We can get food in, we can get people moving back and forth and accessing health. So health is a major part of our well-being as human beings, but we have to engage other sectors and also make the other sectors realize that it's to their own benefit that our population is healthy. Thank you.
Thank you, Emmy. That's really a very clear statement. Finally, to Obina, last but not least. So Obina, the Lancet report, what makes it really unique is the fact that we have a wide range of people ranging from academia to policy making writing the report. And it was really based on evidence. It had an evidence-based approach. And we know that evidence-based policy decision-making can really enhance the Nigeria health sector. But within your report, you also propose setting up a council, a National Medical Research Council. How would setting up such a council achieve such an enhancement?
Okay, so this is where I'll need the attention of my senior brother, the distinguished Senator Olori in this one. Now, Nigeria is one country. You know, at our level, we don't have any national platform for funding health research. And it showed during COVID. We had to get support from outside. You know, you cannot have a country, all the things we discussed, data systems, evidence-based policy making, and we cannot fund research internally. So that's where the idea of a National Medical Research Council comes in. And I hope this is a low-hanging fruit that we can use to address our national health research priorities. The policy is going to come out soon. So we don't need to depend on external sources, you know, with people looking for funding which may not align with what we want. I mean, countries that have done very well, countries like, you know, at our level too, including Ghana, but the example I keep using is Thailand. Thailand has a way of funding the generation of evidence routinely. All this is we're talking about, data systems. Every year they already have a system and it's funded, and the data is available for decision making. When we talk, people say TED fund, but TED fund does not fund other things. But I think for us to move forward, to support the generation of evidence, and then to support the health system, I think it's a National Medical Research Council is a low-hanging fruit that I hope distinguished Senator Olorebe will add to about 11 bills that are health bills, because it's really, I mean, it's really very necessary, and we need it right now. Otherwise, we'll keep talking, we'll never generate the evidence we need where we need them. Thank you very much.
Thank you, Obina. So it looks like a lot of the answers have been directed to my distinguished senator friend, Ibrahim Oloripe. So if the rest of us would support me, I would say that I would like to nominate Senator Oloripe to be the champion for this particular Lancet report. Senator Oloripe, you're only allowed to say yes.
Thank you, distinguished panelists and the Lancet commissioners. When I listen to the reports, and with a lot of due respect, most of it are things over the years that we have known. But the last thing you said was one nation, one health. And we often ask, do we have one health in Nigeria, or we have 38 health systems? And that's the question I'm trying to, within all these researches, and I'll come up with, before some background to the question. Just, I think yesterday, I read the report sent by the Federal Ministry of Health when we asked as part of our oversight for them to provide us report on the performance and implementation of Basic Healthcare Provision Fund. And they wrote, as we speak, there is money released for 2018, 2019, 2020, and 2021. It's only 2018 that has been effectively, say, disbursed. The key thing they said there was that many states are not putting down their counterpart funding. Many states are not meeting the guidelines set up to enable them to get this fund to the health center where it should be. And as somebody that was part of the setup of that fund, I felt very sad because we have money in central bank for 3 years not spent. The one that even was disbursed was not fully utilized. And it's not all states, as we still speak, it's about 33. And nothing can be done because those governors, if they don't, nothing will be done. So when we speak about one health, we speak about more resources to health. We're only referring to one of the 38 components, which is the federal. So the question is, and many countries that you give examples, their political structure and system is different from, but even the Ghana you are talking about, you can talk of one nation, but it's not like that here. How do we, that's my question now, how do we better funded, better managed, and better structure, given our political, or what we call the fiscal structures that we have? How do we navigate that? Because every pressure, everything you write, federal government, when you put up a policy, it will stuck. So that's one of the major challenge, being in this position that I have been and I've seen. The second one, and that also affects even when you talk about more funding. With extra funding, like Basic Healthcare Provision Fund, the insurance that we are trying to talk about, the question will be, these fundings, when they come out of the federal, how does it, still the same thing, how does it get to where it should be? When you talk about primary health care, by virtue of what it is, it's supposed to be the function of the states and local government. But federal government is putting huge resources. They can put more. If they put more, it's still the state. And in answering the question, you have to look at education. I'm sorry to say, I'm speaking much, but I think that is a fundamental thing I want, whether within your research, you are able to look at that. All the functions of each of the level of the government are defined by the Constitution. And I hear my always say, when you bring any law to say, oh, it's not, it's a concurrent list. So the federal government can do, but the state will have to see it as they will just leave. Like Basic Healthcare Provision Fund, I was part of the negotiation with the Governors Forum. When we was the money we are putting for salary and is our contribution. So we are not going to, federal government is now, many of them will now withdraw or they go and be building. So that is what I want to say. But lastly, that's my question and I want answers to that. What you have said very well, we champion the cause and continue to do. I will be willing and I'm committing myself to continue to do what I've been doing. Thank you.
So even though I know Obina is our health economics expert and can answer this, but I would like to give the opportunity to Professor Ibrahim Abubakar because this is something that we have talked about a lot, centralization versus localization and the issue of concurrent responsibilities.
Right, so Honorable Senator, I think the points you made are quite well made and I think they're correct, that throwing in just more resources towards something that is broken isn't going to fix it if the resources are not well used. In our work, we discussed this extensively, and we've looked at specific new ideas. In the time we have available to articulate for you, we were not able to explain the implementation elements and the innovation around how you make sure that you minimize leakages in the system, how you improve governance, learning from others. Nigeria is not unique. India is like Nigeria with multiple countries, and we do case studies from places like that. There are multiple other states in the world where they have the same challenges, and they have found ways to minimize leakages and to run systems efficiently. So I believe that what we need now is to go beyond this launch and presentation and to sit down with you and talk about each of those issues in detail and articulate the solutions so that you can then, in your position as a legislator, act on those and be able to champion the delivery of them, i.e. the implementation element, and translate the theory that we come together, the examples from other countries, to our unique circumstances as a nation, and make them workable. Thank you.
Thank you, Ibrahim. So in your position as legislator, but also in your position as our champion. Thank you. So I do apologize for this has taken a little bit longer than we expected, but I hope the panel discussion was useful. I would like to thank our panelists, all three of them, for your unique insight into this piece of work. And again, I would really strongly recommend that everybody here, including our colleagues, please do read the Lancet paper. A lot of work has gone into it, and it will give you a very good perspective of how we can make our country a better place for our children. Thank you.
Thank you ever so much for that very engaging panel discussion. Our moderator, Dr. Sani Aliyu, Professor Iruka Okeke, Professor Eme Oweje, and of course, Professor Obinna Onwujakwe. Thank you very much for that very engaging question and panel session. I think in a way, the question and answer session, impromptu as it was, that we had with the distinguished senator, I think helps us also to think of some of the questions we may have asked, and maybe within what they asked, those questions were responded to. So I think we will go on, given the fact that we are a bit over for time, and really welcome some stakeholder remarks very briefly. And we'll start off with Richard Houghton, who is the Lancet editor-in-chief. As we mentioned, this preeminent journal has been behind the publication of this report, supported by the UCL team. So we'll start off with some brief stakeholder remarks and continue from there. Thank you.
Hear me. Wish I could be with you in person. But distinguished guests, first of all, let me thank the commissioners for the true. This commission.
Can we please adjust the sound? Thank you. Yeah, we apologize for that. So may I just ask that the sound team readjust and help put the sound out, so we can, if we're not able to get Richard Houghton, we'll get him back. But in the meantime, just to keep moving on, would I hazard we also go on to Caroline Jehuapia, who's Deputy Director from the Bill and Melinda Gates Foundation. Given that we're also having her remarks online, maybe I'll just give the sound team a little bit more time to sort out the sound so that we can actually hear what they're saying, because we really, really want to hear some of their remarks. I'd like to please invite Dr. Walter Kazita Lumbo, the WHO representative, to give your brief remarks, please. Thank you ever so much. And thank you very much for coming, of course.
Dear colleagues and partners, I would like to align with the existing protocol. First of all, thank you so much for inviting WHO to be part of this event, the global launch of the Lancet Nigeria Commission. Very timely, particularly as there is work going on health sector reform. But most importantly, next week we'll be having the Primary Healthcare Summit in Nigeria. So here we have a wealth of evidence to inform those reflections. But above all, it's about repositioning health, not as a consumption good, but as an enabler for economic development. And we've seen the impact of COVID-19 in the economy globally and in Nigeria. I think it's also an opportunity to re-emphasize the place of primary health care as overall roadmap toward universal health coverage. In 2018, we had the Astana Conference and the Astana Declaration, which Nigeria signed off alongside other countries. And you remember there were 3 pillars. The first one was the multi-sectoral policy platform and action, emphasizing the whole of government approach, the whole of society approach. If we are to succeed, we need to realize that investing in health is not just a matter of Minister of Health. It goes beyond Minister of Health to embrace other sectors of the government, alongside other sectors of the society, including civil society organizations, the community we serve themselves. The second component is about putting in place mechanisms for integrated health service delivery, focusing on prevention, particularly with a country like Nigeria with a young population, as was emphasized during the presentation today. And last but not least, is to ensure that the community themselves are empowered to make choices about the health they need and to strengthen the foundation of health system. One nation, one health. When we say one health, it's important that we realize that one health means universal coverage, but also health security, have the other side of the coin. It's very important to invest in health system foundation, to build system that can resist future shock, but it's also at the same time building capacity to respond to shock when they come. And the COVID-19 pandemic has shown that no country was ready. If we don't prepare now, most likely we'll face the same situation when the next pandemic eventually hits. As you know, the pandemic we've been preparing for was not COVID-19 pandemic. It was full pandemic. It's still here to hit. But we have the opportunity to learn from COVID-19 to better prepare for the next pandemic. So congratulations to the member of this commission. This is an excellent piece of work that will certainly help Nigeria do better in terms of reflecting on how to redirect the health system and health security in the country. Thank you again for allowing WHO to be part of this exercise.
Thank you very much, Dr. Mulombo, for your opening remarks. Sorry, for your stakeholder remarks. We always welcome the support of all our partners in the work we do. I'd like to please try and bring on Richard Houghton once again. I understand there was some interference when he was trying to give his remarks. Thank you so much, Richard, for joining us again. Apologies for the sound issues.
Than me, but I did want. Commitment to you is to continue to build and